What if the same radiation that kills cancer slowly damages the bone? This is known as osteoradionecrosis. It is commonly known as ORN, which is a serious complication of radiotherapy in head and neck cancers. It is characterized by a non healing necrotic bone in a previously irradiated area for more than 6 months with the recurrence of tumor. So, let's learn more about it. It is the acute form of osteomyelitis and it causes severe damage to the intraosseous blood vessels. For a simpler understanding, radiation damages your blood vessels, which in return reduces the blood supply, and then your bone becomes weak. It cannot heal itself, and then it eventually dies or necrose. So, radiation includes pathologic processes, which is chronic, painful, and shows necrosis. Marx gave 3H principle for osteoradionecrosis, hypoxia, hypovascularity, and hypocellularity. Osteoradionecrosis patient often complains of fetid odor, and three factors involved are radiation, trauma, and infection, as we have discussed this many times. So, the definition which was given for osteoradionecrosis by Marx was: it is an area greater than 1 centimeter of exposed bone in the field of irradiation that had failed to show any evidence of healing for at least 6 months. So, we have discussed it many times. I hope now you have understood this concept. The first sign of osteoradionecrosis is xerostomia. So, the clinical features are intractable pain, trismus, exposed bone, pus fistula, pathological fracture, and as we have discussed, fetid odor and xerostomia are main features. The pathogenesis includes ionizing radiation, which leads to endarteritis, that is inflammation of vessels, and then the vessel wall fibrose and hyalinization occurs, leading to ischemia. Death of osteocytes and osteoblasts is observed, hence no new bone formation, and suddenly trauma occurs, infection and exposed necrotic bone is observed. Before diving deep into osteoradionecrosis, let's understand the difference between medication related osteonecrosis and osteoradionecrosis. So, osteoradionecrosis is caused by radiation, whereas MRON is caused by drugs like the above mentioned ones, and there is a loss of blood supply in osteoradionecrosis, whereas in medication related osteonecrosis of jaw, the bone turnover is gone. Its histopathology is osteocyte destruction can be seen, no osteoblastic activity is seen, and arteritis and chronic inflammatory cells are seen, and you can see the histopathological diagram of it. Marx classified osteoradionecrosis into three types. It is very important to write this classification in your theory examinations. So, the type 1 classification is when osteoradionecrosis occurs shortly after radiation, and it occurs due to usually surgical trauma or radiation injury. Exposed alveolar bone is seen with no pathological bone fracture. Type 2 osteoradionecrosis occurs years after the radiation therapy or whenever the trauma has occurred, and it does not respond to hyperbaric oxygen therapy. We'll learn about the treatment further. Type 3 is when full bone thickness is damaged and orocutaneous fistula can also be observed. So, The treatment of type 1 osteoradionecrosis is just hyperbaric oxygen, whereas in type 2, sequestrectomy is required, and in type 3, we need to treat it with hyperbaric oxygen along with the treatment of fracture, fistula, and it may require resection. Overall, the treatment is it requires 2.4 atmospheric pressure, 90 minutes per dive, 1 dive per day, and 30 dives is given initially. If the condition improves, then 40 dives is given. If it does not improve, then surgical intervention is required. Now let's learn the treatment in detail. So, if someone is suffering from stage 1, conservative treatment is required. Saline and chlorhexidine mouthwash is given, analgesic antibiotic is given, and in adjunct therapy, HBO therapy is given. 30 dives pre-treatment in 2.4 atmospheric pressure, 90 minutes per session. If the condition improves, 40 lives is given, and if it does not improve, then it leads to stage 2, where transoral sequestrectomy with primary wound closure is again followed by HBO therapy. Pre treatment 30 dives is given, and then 40 dives is given after the surgery, and the medical adjunct is PENTO therapy, that is pentooxyphylline, and tocopherol, that is vitamin E. In case of stage 3, resection and reconstruction is the only treatment. So first the resection of the affected bone is done or segmental mandibulectomy, then the reconstruction plate is given and fibula flap is given. Free vascularized bone graft can also be used, and same 30 dives pre-op and 40 dives post-op is given, and which is followed by pentochlorotherapy, that is pentoxyphylline and tocopherol with chlordronorate. So I have summarized the treatment overall. If you want, you can take screenshot of this and learn this, and just learn the atmospheric pressure and the HPO which is given. That would be enough at your undergraduation level. If you like the video, please like, share and subscribe.